my name is John Richard Pagan, and I'm here with James Moorhead to discuss verbal and physical abuse. Uh, James Moorhead uh, has received his master's degree in gerontology from the Gerontology Institute of Georgia State University. After graduating, he worked for the Georgia Department of Human Services Division of Aging Services, where he managed non-Medicaid in-home services. This role, he had the honor of serving on the Georgia Alzheimer's and Related Dementia Task Force. Now, James works with the Maine Department of Health and Human Services Office of Aging and Disability Services as the Aging Service Manager, where he manages non-Medicaid home and community-based services funded by the Older American Act, including state-funded respite care services for caregivers and people living with dementia. Did I get that right, James?
Absolutely, yes.
Okay, then welcome. Glad to have you here. With the subject of verbal and physical abuse, one of the first questions I wanted to ask is, when we talk about verbal and physical abuse, what does that entail?
Right. So first, I want to take a little step back and really define what is abuse, and I think this will help answer that question. Abuse is about power and control, right? And so it's one individual abusing another to either maintain control in a situation or to establish dominance. And so, in order to do that, one individual uses certain behaviors and tactics on another to maintain that power. So that person may hit an individual, and that hitting can vary from very violent abuse, like physical abuse, like hitting, punching, biting, and that also can be very covert, where abusers make sure that the abuse is not visible. So they may not hit an individual in the face, but they'll hit them in the thighs and arms, where it can be easily concealed so that others don't know. And in terms of the physical abuse or the verbal abuse, we're really talking about that psychological abuse. It's the name calling, it's the degrading, it's telling that person that they're worthless, that you wouldn't be anything without me. I control everything about this situation. And it's really about putting that person down with their words. So yeah, that's how we typically define both psychological abuse and physical abuse. And I would like to point out that when we're talking about abuse, specifically with individuals with dementia or older adults, typically the abuse is focused on financial exploitation. And I think this topic is a really important topic because it goes unreported and it's hidden and it's not really talked about. And so that's why I really am interested in this topic, because how do we empower those who are being victims of both verbal and physical abuse to empower themselves to make their lives better?
Okay, yeah, very good question. I tend to think of the abuse as the outright attacks, and I don't think about the subtler versions of abuse.
Right. And that's where, abuse is on a spectrum, really. And it can be temporal. It means it can be episodic, or it can be continuous over a lifetime. And where this becomes really interesting, especially if we're looking at individuals living with dementia, is there's that power dynamics between the care partners. Mm-hmm. And those power dynamics didn't happen overnight. They've been developing over a lifetime. And so as, situations change, because we know that dementia manifests very differently in different folks, that one care partner may respond to those behaviors very differently from another.
So are you also saying that that these abuses build over time?
Yeah, I mean, it could be where um, it, I'm hypotheticals here,
Okay.
where it could be where the individual who develops dementia, some form of dementia, was the abuser, right? And
Okay.
they've been the abuser for a very long time. Well, now that's going to change the relationships between the care partners, and then vice versa. Um, it could be where that person's been a victim of abuse, and that stress and that anxiety is um, compounding with their dementia. And so, it's kind of a little bit of the chicken or the egg situation going on.
I think you also brought up something else within that statement. You mentioned that the abuser can be either or.
Right. It can be. And that's where this becomes really tricky because, especially when we're talking about later stages of dementia, and that person's not really aware of the behaviors that they're exhibiting. Like they're responding to their environment using physical violence because they're unfamiliar with their environment. That's just how they respond. Well, then, okay, how's the care partner who's providing the care going to respond to that? Right. And I think that's where some of the strategies that we're going to talk about later is focusing on both, right? How do we deliver services to both so that we can prevent these and mitigate some of the risks?
Good questions. Good questions. Um, when you mentioned the abuse and financial exploitation, financial issues, can you tell me a little bit more about that?
Right. So, oftentimes when we talk about elder abuse, or abuse with individuals, dementia, we're focusing on the financial scams. How do we protect ourselves against the scammers? There's a lot of efforts, both at the national and federal level, to work with banks on how to recognize financial exploitation of vulnerable populations. Here in Maine, we have a program called Money Minders, and in Georgia, we were working with banks through the Bank Safe program, and so there's these various programs. Again, my point is that they've been focusing on the financial exploitation aspect of abuse, and as we know, abuses comes in various forms.
Mhm. So, but is there a relationship between financial exploitation and physical abuse and verbal?
I don't know. That's a hard question. Um, that's a hard question because oftentimes we don't conceptualize financial exploitation as abuse, right? When we oftentimes it's the adult child or the one providing care that's like, oh, I'm entitled to that,
Okay.
right? And that person won't know.
Mhm.
And it's those type of situations that's where the financial exploitation is abuse
Okay.
because it's not that individual making those decisions.
Right.
That makes sense.
Yes.
Yep.
The getting back to the verbal and physical abuse, um, are the rules the same? Or is it defined the same way from state to state? Is it different from different states?
Um, I think it's pretty consistent, and I think one of the common threads around this is around adult protective services. So
Okay.
each state and territory they receive funds through the Older Americans Act to deliver adult protective services. And in defining the abuse, it's pretty consistent that we, in my interactions across the country, is the definitions of abuse. They make it a point to point out all types of abuse.
Hmm. I guess my question is that I've heard that uh, where it's older is well defined.
Hmm.
Dementia, it does not always happen in the older population.
Correct. Absolutely. And I think that's where adult protective services are beginning to understand that. And
Okay.
so they're not necessarily looking at age, they're looking at the diagnosis.
So you think that they are becoming more aware of that and
Oh,
trying to be
absolutely.
more protective of a wider range of people.
Absolutely. And one of the growing, emerging trends is the early onset. We know early onset can start manifesting within 40s, in your 40s. So, how do we target our outreach to those populations? Because that's when, again, they're in the early stages of their journey. And so that's when those interventions become even more important,
Hmm.
right? And it's not waiting until 20 years down the road and being reactionary. So yes, that is a growing trend across the nation.
Good. Good to know. And speaking of that, what do we look for when we're talking about risk factors, things that can suggest that abuse is occurring or may occur in a environment?
Yeah, so there are known risk factors for um, abuse, especially when we're talking about with an individual who has dementia. Um, I like to look at it both dyads, right, of that relationship between care partners. And first, for this, it's easier for me to keep it this straight in my mind. I am going to use caregiver and care receiver just so that we can keep this a little separate right now. And I understand that language matters, and I'm trying my best. I get it, but we got to make these distinctions right now. For caregivers, again, we rely mostly on informal caregivers. One of the strongest predictors of abusive behavior is that they were the recipient of being abused. So we know that abuse is very cyclical in nature, right? It's the abused become the abuser, and that's again how they deal with that history of abuse. So we know that a history of abuse is the number one predictor. Then we also want to talk about the caregiver burden, right? And the stress and doing this work day in and day out. It takes a mental toll. And that is, again, kind of that the most common risk factors associated with abuse is, again, that caregiver burden and stress. And with that caregiver burden and stress comes the depression, the anxiety, alcohol use. So illicit drug use is another risk factor. Social isolation is so important. And I want to talk about the caregiver's isolation. Is this is that person again trying to maintain power and order within their environment, right? That's what abuse is. And so they feel like the only way that they can control that again is to abuse that individual. So you're always making, I can't go out with my friends, I can't go out with family and friends because I'm here with you, I'm always here with you. And that's where again they lash out. And then also another predictor is poor relationships, right? Again, between that dyad of there's just not that familial connection or those strong bonds. And so they don't know how that individual is presenting their disease, right?
Mhm.
It's they're not understanding the behavior. So that's where education becomes so important.
So I hear you talking about the power and the control in the environment for the caregiver, and isn't that part of caregiving? Being a care partner is that they have to take over all the bills. They have to take care of all the task making and making sure medications are taken or whatever it is. Uh,
Right.
how do you differentiate one from the other?
I don't think you necessarily can. Um, Thinking of my aunt's going through this right now, and without getting into details, she's being presented. So my uncle is he has dementia, but he's very reluctant to go get a diagnosis. He's very reluctant to accept care. He'll go to the eye doctor, he'll go to the dentist, but he won't go to the regular physician because he's afraid of the diagnosis, and I think he's aware of it. And my aunt, there are some risk factors that he's presented over time, not an abuse, but we're also getting into a realm here. I told my aunt, well, I was back home this past weekend, and I told my aunt, I was like, you're on the verge of abuse because you're leaving him alone. And that is neglect. That is a form of abuse. And so, because I think she's afraid of taking on all those responsibilities, like you just pointed out, like she wasn't used to doing all the finances. She wasn't used to doing all of this. And so that added pressure and assuming a new role in that relationship is often too much.
You mentioned I'm trying to keep this in 20 minutes. We'll see if we
Yeah.
can. You mentioned the risk factors for the caregiver, and then there are risk factors also for care recipient.
Right. Again, that's those risk. For me, the risk factors are more environmental. That's what the literature is saying. I don't want to place the blame on the individual because, again, depending on where they are in their journey, they may not be aware of what they're doing. And that's, again, we know dementia is a risk factor. And the type of dementia also is a risk factor. And that's really where we are right now. We really don't understand what the other risk factors are. We know what the risk factors are for developing dementia, but we don't know about the risk factors for exhibiting abusive behavior.
Okay.
That makes sense? Yeah.
What can we do to identify strategies to at least improve things so that we're less at risk
Right.
of moving in that direction?
Um, First and foremost, caregiver support. It really does come down to that. There are some interventions being tested right now that are internet-based support groups because we recognize that care partners may not be able to get out of the house and physically go to a support group. And those have been shown to, again, reduce the anxiety and depression, which we know are risk factors for abusive behavior among care partners, the caregiver. Again, for those individuals who can attend caregiver support groups, those are so important. They have been proven time and time again to reduce the risk for abuse. And respite services. So one of the things that we fund here through the Older Americans Act and state-funded services are those respite services to give that caregiver that break to, okay, sometimes they just need to go walk away, right?
Mm-hmm.
And providing those opportunities and those outlets are so important. And doing that at the appropriate time matters, not waiting till there's a crisis, but doing those in a preventative manner. And then I would like to also address system change. We need better dementia-related education and training between APS workers, adult protective workers, direct care workers, those individuals that are on the front lines. They don't receive much training at all on how to deal with dementia. Most of their training's on the job. So how do we mitigate that risk within those formal caregiving situations? And again, it's all about that education and training. And then lastly, I do think that this is kind of tying systems change in with empowering the individual. is we need to create a system around adult protective services and, again, around our public guardianship programs to make it to open that door for the individual to report the abuse. So too often that individual feels trapped, that now this my abuser the abuser has financial power of attorney, they have healthcare power of attorney, they have all of the legal controls. How do I advocate for myself that in the situation? So too often they feel like the deck is stacked against them. So how do we modify the APS system and public guardianship system to reduce those barriers? And I think one of the things that have become really developed out of this is around the supported decision making, is using that as an approach and as an alternative model to, again, empower that individual with dementia to keep their rights and their decision making capacity, right? So again, how does APS, instead of looking at the abuser to make those decisions, are there other individuals in their social network that can substitute that decision-making power?
Okay.
And then, like I said, again, it's very hard for that individual to envision life without their perpetrator in their situation. They may be financially dependent on their abuser. The house is in the abuser's name, and it can feel daunting. So that's where I think we have to work together, both the formal systems and the community as a whole, to help individuals who are in these situations, to help them empower themselves to report the abuse.
I suspect this is going to be a conversation that we could go on for a whole lot longer.
Absolutely.
Than 20 minutes. Would you be willing to come back after we meet on later this month? Would you be willing to come back and do another video to further discuss this with the questions that come up?
Yeah, absolutely.
Good. James, I want to thank you for your time with us here. I know that we're going to have a moment of brief discussion where people can ask questions.
Absolutely.
And then I will close by just thanking you and asking you if you have any last moment statements that you wanted to make.
No, thank you so much for this opportunity. There's a lot of work that needs to be done in this field, and thank you for your opportunity to amplify that and bring it to the forefront.
Thank you.
We're living beyond dementia, connecting our lives to help us survive. So we live our time to the fullest. We